We are live again, and today we have one of a good practitioner, a classical one with us. And let me tell you the topic of today's live session. It's about keynotes. I guess every one of us read that since our first year and till our last days of practice. It's that important. So today we are going to discuss keynotes and how we can master it. So we have Dr. Ranjan Bazare with us. He's a classical homeopath, and he has been practicing for more than 9 years now. And you all know what is the fuss about classical practice and how it's important. So I'll welcome him. He's also a young achiever awardee, and he was awarded in the field of homeopathy for that and for his services in homeopathy. So let me invite him to join us. Some experience about keynotes. We have a lot of doctors with us, so I want you to comment down one of your experiences with keynotes. Hello, welcome, sir. Good
Hello.
morning.
Namaste.
So I was introducing you just briefly because it's not a very formal seminar or something. So we are doing a casual live session. So I was telling them, yeah, like you're a young achiever awardee. How was the experience of getting that in such a young age?
No, it took me nearly 8 to 9 years to receive that Young Achievers Award. It's not that I received it in my early age. It's a good feeling when you are get recognition for the work you are doing, and it's always special to get an award. And that's what I can say.
Mhm. Uh, I was telling the audience like we all read keynotes from our first year. Since the day we come into homeopathy, our first day we receive that book as a Bible. So you read that word by word, and then you are a good homeopath. And it's not enough. We require a lot of books, but it's the basic we need, and we need to master it. Until the last days of our practice, we need that. So today we are going to discuss that. So I want you to brief a little about keynotes, about its importance and how.
Okay. Uh, so first of all, I came from a allopathic background. Okay, so I was not. I was studying homeopathy, but I was never destined to be a homeopath from my first year to final year. I never wanted to do homeopathy, nor I have any interest. I used to do job at ICU at multi-specialty hospitals and was very much keen to doing allopathic practice. Many people like me do these kind of things in their young age because they don't know how homeopathy can help them in the future. So after that, something happened, and I converted to homeopathy. And I am a classical homeopath. I can say a full-time homeopath. I never give any allopathic medicine, whatever it is. But from the beginning, that upbringing in the allopathic hospitals made me realize that they have a certain pharmacopoeia, pharmacology book they have. They have certain indications for each and every molecule they prescribe, their reactions, adverse effects, when to give them, what are the contrary effects, what are the side effects. So that was my upbringing. So mostly when I went to, I was converting to homeopathy, I didn't find any such a pharmacology book or like that. We have Dr. Dubey's textbook, as we all know, but it is mostly used for exam purposes. It's a good book if you use it practically, no doubt, but we use it as a exam for only for the exam purposes. So when I went to Kolkata, I went on that. No, there is a certain book which we call Allen Keynotes, which we can follow to derive indications and to prescribe uh, on this indication to get a good is a pharmacology book for homeopathy. As we say, there are many books, no doubt, but this is the basic book where you can find many important pure proving symptoms the symptoms which are verified by many practitioners, and which is in itself is a complete package of pathology, characteristic, general indication. So I always then I moved there, and uh, I liked that pro forma uh, very much. So it was easy for me, for the upbringing of me from where I came. It was very easy to grasp that. So I moved on that, and after getting results, after applying it in practice, I said this is the right way to do it. That's why I to every young homeopath I say that um, our Matra Medica is more of that we are it's based on what we have heard. We don't go for the classical books many a times. Many people's just like that we heard from somebody that Lycopodium is like the Mussolini, Brania is like the greedy, Arsenic is like avarice, Prana is very haughty. So we had that certain image in our mind of that particular remedy based on some of others' experience. We never read any book. We never read any classical literature that lead sometimes to prescribing wrong remedies, or sometimes uh, overusing any remedy. But if you have some certain map, certain symptomology of any remedy, it is very easy to prescribe, and it is easy to see in the patient that patient is actually talking what is written in the book. So that's how I converted into using keynotes and other classical literature books. So that was my understanding of using it, because we need a certain firm knowledge of symptoms. Homeopathy is based on symptoms. Homeopathy is symptoms. So we have symptoms in our hands to be a good prescriber. So that was my understanding, and that's how I proceeded in my practice with the keynotes.
Sir, I wanted to know how can we like approach keynotes कि हम कैसे उसमें अपनी अंडरस्टैंडिंग को उसको किस सिस्टम से हम पढ़ें कि हमें उसके सारे एसेंस को हम ग्रैब कर पाए. It's written point by point, but still we have to have a system कि हम कैसे उसको अप्रोच कर रहे हैं और कैसे वो हमारी अंडरस्टैंडिंग में डीप डाउन जा रहा है.
Yes, Alan Keynote is written in a symptomatic way. It's not a haphazard symptoms which taken from the Matra Medicas or from the hearing guiding symptom. It is written in a very systematic way. First few lines will indicate you the pathology, the characteristic generals. Like in podophyllum, you have the bill, or when you see Halonias dioica, you see that for the women who have luxurious lifestyle or worn out by overwork. So you can have first line for this pathology for constitution, then there is a gram generalization, then there are some particulars, then the particulars of the specific remedies. Just like if you want to prescribe a nux vomica for the constitution, the nux vomica constipation should be ineffectual urge. The patient used to go to the toilet again and again, have a feeling that it's not completely done yet with the tenesmus. For example, if you have take a backache of nux vomica, when you prescribe nux vomica in the backache, when the patient has difficulty in turning in the bed, so that is the particular, and it is given. Then after there are modalities, then there are the relationships where you can find the how to approach for the other remedies, like in Drosera. Many times I said that we prescribe Drosera very much, but after Drosera, what to do? In Alan Kunos, you can see that when the Drosera had relieved the symptoms, but yet not cured, you prescribe Sina. And we never thought of Sina. Okay. When the abrotenum, when the Brania failed, you give abrotenum. So that's how it's all connected. Okay. So it is very systematic book. First, you can judge a constitution, you judge the particulars, you judge a modality, a relationship. Everything is covered in this small book. So sometimes you don't need to refer the another book, but it's a very unique and complete book if you study it by point by point. Many people think that it's a very haphazard book. that so many symptoms are incorporated in one book. No, it's not like that. It is a systematic book. I have made many videos on this, how to read annual keynotes, which I learned from my gurus, Dr. Adhikari sir, Dr. Naveen Singh sir, who introduced me to this pattern. And that's how I learned uh, 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 that how to read Allen keynotes. I have a video on the YouTube how to read Allen keynotes. Okay. So this was shaped and this was embedded in us by our gurus, that this is the way to read Allen keynotes. That it is written in a very systematic way. Dr. L.M. Khan sir told us how to use the relationship parts. Okay. So when you have Dalkamara patient, it should be accompanied with the salivation. If you read in the relationship part, it is similar to Merck in Tylism. What it indicates that it has same degree of salivation like Merck. So we never go through it. If salivation by mouth, mostly with Merck. No, it may be Dalkamara. So it deepens our understanding. So that's how we are. It's embedded in us, and that's how it is very useful to us. And because it is, if you go it line by line, you understand that there is such a systemic pattern that कि भाई ये ऐसा ऐसा लिखा है, and it is very easy to read and very easy to remember if you go to that pattern.
That was very wonderful to understand कि कैसे हमें उसे अप्रोच करना है. Along that, sir, I wanted to ask you कि इसमें हम अपने जब हम प्रिस्क्राइब कर रहे हैं पेशेंट, तो हमें उसमें केस टेकिंग में ऐसे क्या पॉइंट्स का ध्यान रखना है कि हम की नोट्स को अप्रोच कर पाएं, और इसमें कुछ चेंजेस हैं केस टेकिंग के लिए, या इट्स ऑल सेम एज रिटन इन ऑर्गेनॉन, या हमें कुछ उसमें एडिशनल अपने भी पॉइंट्स अपने कुछ प्रैक्टिस में अपने लाना है कि हम उसे बेटर कर पाएं?
The first thing is कि भाई case taking is which is written in the organon. It is the classical way of case taking. This is how you take a case, and that's how it is embedded in the Allen keynotes. कि आपको भी क्या देखना है? How the patient is talking, how the patient is walking, how the patient came to you. Okay, this all written in the Allen keynotes. कि भाई पहले क्या देखना है कि patient कैसा है? If patient is robust, patient is lean thin, patient is obese like Antim crude, if the patient is it is timid, patient is nervous. So this how we should take a case. What we do is, when the patient came, we put our head down, take a pen and write all the things what patient said. I mean, we never look up to the patient. We never look up the patient that how his facial expressions are. If the patient is having pain in agonizing pain, we never think of ethusa, agonizing pain, agony. Patient is in agony. We never see. We never see the telltale face of sepia. That patient is looking like you and want to tell you something. That is called telltale face, and it is never been getting understood because we are so much deep in writing and never in observing. Okay, so one thing you have to do in whenever you take a case, कि patient से बात करो, just connect with the patient and differentiate every symptoms. Okay, कि भाई patient को बैठने से आराम है. If the patient is having ambulation by sitting up, patient is getting up, तो भी कैसे आराम है? We have to differentiate, and these final differentiations are given in the Allen keynotes. For example, ruta backache is better by lying on the back. Rust simply is aggravated by lying on the back. It is better on the sides. These are the simple differentiations which is mentioned in the Allen keynotes. That's how you have to proceed. We took only one symptoms, backache. उसके बाद ये है, उसके बाद ये है. We never go in the deep. Okay, कि भाई इसके बाद क्या symptom होगा? How it started? If the coryza started after an injury, we can easily think of euphoria. If the patient had history of alcoholism, if the patient is having this sour irritation and belching, we never think of acid sulf. So this how we should approach that. We should take every symptom and we have to differentiate how it started, its origin, its sensation, its how it is accompanied with the concomitants, and the modalities has to be differentiated. So that part you have to integrate in your case taking. Otherwise, it will not going to help. Otherwise, there are same sulfur patient, there are same calcura patient, there are same lycopodium patient. जो भी gastric का patient आ रहा है वो lycopodium ही है. That's how you can think of. Yesterday, I had a intern in my in my clinic, and a patient came for this uh, bilious, some bilious complaint that कि सब पेट फूला रहता है. I have gastric symptoms like that, and right side में सर पेट दुखता है वैसा है. All the things on the right side, patient desire for sweets, but सर मैं खाना गरम नहीं खा सकता. I want cold food. Okay, so if you कि भाई सब तो है लाइकोपोडियम में था, थोड़ा सा लाइकोपोडियम में कोल्ड भी आता ही है. हमारे रेपर्टरी में डिजायर फॉर कोल्ड भी लाइकोपोडियम में दिया है तो हम दे सकते हैं. No. Instead, you can think of podophyllum, which have same affection, same biliousness on the right side, but it desires cold water. It desires cold things, and the other things are the same. Because many times, many symptoms, if the many group of the symptoms are only integrated by one word, bilious constitution, bilious complaint. It means all the bilious complaint: acidity, gases, belching, fullness. The author doesn't need to write all the things. If the bilious complaints are there, this hemorrhoid diastasis, there should be hemorrhage from the everything. The menses will, there will be epistaxis, there will be hemorrhaging of blood. It is never going to mention that कि भाई सब चीजें एक साथ लिखा होना चाहिए. So you have to be specific on that point. After that, you have to connect the dot, and then you have to differentiate. Okay, कि भाई ये है, but ये नहीं है. Then it is this. In between Rustox and Brania, Fatulaka we see. Rustox patient is chilly, Brania patient is hot. It is better by rest. It is better. Rustox is better by apla. It's aggravated by rest. So if you're not getting either Rustox or Brania symptoms, the patient is hot, but it is better by warm. So it is contradictory. Neither is going with the Rustox, neither is going with the Brania. So you have to prescribe Fatulaka. That's how it is written. Then the author doesn't need to write that Rustox had these symptoms, Brania had these symptoms. Now, if you don't get this, and then you have to, it take a lot of space to accumulate all the symptoms. But just generally, those who know Rustox, those who know Brania, they didn't get. It is in between कि भाई आधा इसका मिल रहा है, आधा इसका मिल रहा है. Then you have to prescribe Fatulaka. It is as simple as that. So that's how we had to approach. Another example is, okay, if you are permitting me, how to do it. Okay, many times many patients of PCOD came to us. PCOD patients came to us and they told us, okay, by patient is sad, patient is melancholic, it is aggravated by consolation and like that, and you prescribe Natramur. The patient doesn't get results. Okay, you have to ask one particular thing: how menses was started? Does menses appeared first for few months or few days or a couple of months, and then they are discontinued, and then they are regular, and then they are not coming on the regular interval? So it is a complete amenorrhea. You have to take medicine, allopathic medicine. After that, only the menses appears. For this, the best remedy is Helleborus. If you see on the first page, fourth, fifth line, it is written that melancholy, depressed patient, puberty when menses fail to appear after puberty. Below that, we have consolation aggravation like Natramur, sad, depressed like Natramur. So seemingly Natramur, but the patient has this peculiar symptom of that patient. My whole process is my menses are irregular since puberty. एक दो महीने है सर, उसके बाद तो सर ये सब गड़बड़ हो गया कर. So this is how we have to approach, and this is the final differentiation we have to understand when we do a case taking, when we inquire patient, when we look at the patient, how it is. If he had the same frowning like lycopodium, we can easily understand that it is a patient of Helleborus, not Natramur. So this how we have to incorporate, and this how we have to prescribe, and that's how we will get results. And that's why I said that some medicines are over-prescribed. Just like lycopodium, I gave an example. Just like Helleborus, the Natramur, these remedies are very over-prescribed, and what young people do, they oversimplify sometimes. कि ये है, चलो ये है. because we have some knowledge of repertory, we have some knowledge of मैथमेटिका. हमने ये कुछ सुना था, ये कुछ सुना था कि पल्सेरिला थर्स्टलेस भी रहता है, थर्स्टी भी रहता है, ब्राइनिया हॉट भी रहता है, ब्राइनिया चिली भी रहता है. कोई बोलता है हम थर्मल्स नहीं देखते, कोई बोलता है. दिस इज अ होल कंफ्यूजन in anybody's mind, and that leads ultimately to the failure. Beside that, if you go in the classical textbook, it is clearly mentioned कि भाई that Brownia patient is hot, pulsatile is like a weathercock, Mersol is Mersol is ambithermal. This is you have to take into consideration. If you have to match generals, you have to match generals. If you get particulars, then no doubt we have to match other things also. Like Hahnemann said, we have to prescribe on the totality, not on the individual symptom. So that's how we have to incorporate this in our case taking, so that we can be successful in our practice.
वंडरफुल. मैंने बहुत सारी चीजें नई सीखी हैं आज. थैंक यू सर. आई होप बाकी लोग भी आज बहुत कुछ नया सीख रहे हैं, और अगर किसी के इसके साथ साथ भी कोई क्वेरीज हैं, यू वांट टू नो मोर, you can let us know in the comments. Like we have one comment. Sir, what is the scope of homeopathy in lipoma cases and cholelithiasis cases?
In lab, see, homeopathy has bigger scope, and we don't have to limit in all these cases. If a patient is get better to with any homeopathic practitioner, it means there is a scope. अगर कोई पेशेंट, सिंपल मैं बोलता हूँ कि अगर कोई पेशेंट किसी होम्योपैथ के पास ठीक हो रहा है लाइपोमा का, किसी कोलिथिस का कोई पेशेंट ठीक हो रहा है किसी होम्योपैथ के पास, it means it has a scope. We don't discriminate the scope with the pathology. We discriminate the scope with the patient, how patient symptom is patient is giving us the symptom. Patients are uncurable or curable. The diseases are not incurable or curable. If the patient is, it's his symptomology will determine that patient is curable or not. So whatever may be the disease, didn't you see many cholelithiasis patients are getting better with many homeopaths? We don't see results. We are seeing many results with the lipomas from the many homeopaths. It means it has a scope. So we don't have to limit ourselves with the scope. Our first and final motto should be how to practice correct homeopathy. There is an abundant scope of homeopathy in each and every disease condition. Either it may be curative, either it may be palliative. I'm not going deep into that. But there is a scope, there is a certain scope in each and every disease condition in homeopathy. So we don't have to limit कि भाई इसमें तो ये तो सर ये तो ठीक नहीं होता है होम्योपैथी में सर ये this is bullshit. I can say each and everything is responded. We have scope. We don't have a scope in cancer cases. We don't have a scope in autoimmune diseases, as someone is asking. Does we don't have a scope in vitiligo cases? Yes, we saw so many cured cases from so many homeopaths. So yes, definitely, certainly there is a scope of homeopathy in each and every disease condition. But we have to be very keen towards applying homeopathy in that condition. There is unlimited scope in each and every disease, either curative, either palliative. We are not discussing with this, but there is a certain scope in each and every disease.
There is another question. Can you tell what should be considered in fevers?
Fever is a big topic. There are many facets to it. Okay, how it is started, the onsets, how it is started with the fright, fear. Then yesterday I had a patient that a boy of 7 years who got his fever after he had attack of fright, and he was loquacious and like that. We prescribed him stramonium. If the patients have, it is clear that when you get a cold in a hot weather by drinking cold thing or getting any Colvin, it is brine. So that's how we have to proceed. We have to go for the simple things. What happen is that कि भाई fever आ गया तो अरे अभी क्या करेंगे? We have to give paracetamol. Maybe I don't blame that, because sometimes patient gets panic. Patient gets uh, uh, very very much concerned about the child or their health. But if you are confident enough, then you can do it. For example, I had a case a few months back. There was a huge epidemic of viral fever here, and most of the children were suffering. And they went to a allopath, a pediatrician, and after 5 days also, the patient's fever was not going down. And they came to me कि भाई सर हमने 5 दिन एलोपैथ को दिखाया, वो बोल रहे कि टेस्ट करो, ये करो, वो करो, and we are not willing to do that. And please just help us. I took a case like this, and I was prescribing belladonna, and somehow her father, patient's father, told her that sir ये लाइट बर्दाश्त नहीं कर पाती है सर. बोला why? बोले क्या हुआ? नहीं सर वो लाइट लगा रहे तो वो बोलते बंद करो. She can't tolerate light. So on that, there is a line in Alan Keynote, in conium, photophobia without the actual inflammation of the eyes. And there was no inflammation, no conjunctivitis, nothing. The patient cannot tolerate light, shuns the light, band kar do. And I prescribed conium. The patient was better very next day. So sometimes we underestimate ourselves. So there is nothing any peculiar specific कि भाई सर ये इसमें ये दे दो, उसमें वो दे दो. If you do practice like that, you will fail most of the time. If you go with the symptoms, you go with the system, you will be successful most of the time. So that's how we have to approach. कि भाई कुछ ये हो गया, pulse. If the septic pathology is there, pulse is not covered, simply prescribe pyrogen. Many cases of septic fevers are getting better with pyrogen. Early stage of typhoid, patient is getting high fever, not touching to the baseline, patient is thirsty, patient is hot, wants air, patient's mouths are dry, lips are dry. Patient came to you, sir, ऐसा हो रहा है 3 दिन से. Give brine here. It is written in the book. So that's how we have to proceed for this fever case. But you have to take up perfect totality. कि भाई इसमें क्या है? Patient is chilly, wants to be covered every time. Okay. Naksumika doesn't want to be covered. That's how you have to proceed. भी कैसे चालू हुआ, क्या हुआ? You have to, वहां पे आपको देखना है कि ये आगे आगे कैसे बढ़ाए करके. So it is very easy, and then the results are sure shot. 100%.
So इसमें question ये भी है, is there any limitation to Allen's keynote? Like, is there any limiting factor which we have to overcome, or we have to access some other books,
Yeah.
or some other sources for that?
Okay. The basic limitation, I think, of Allen Keynote is it is written in very compact manner, and written in a very in a way that it should have deeper meaning with only one word or like this. They don't explain. We have the explanatory material medicals like Kent Property. It is self-explanatory. It is like lecture. We have Emil Tyler's book. We have Anam Chaudhary's book, where they give a reflection of the symptom, how the symptom is getting evolved, or how you can see it in the practice. Sometimes it is not there in the Allen Keynote. It is a very clean and very plain symptom is there. Just like what I said, photophobia without actual inflammation, how you can see in the patients. You have to see like this. Sometimes, just like like a patient hai. We all know that patient is getting aggravated after sleep, but many times you don't know how to use it. Okay, so if you go through NASH, we had a case. We have many cases, but just we had a case. कि भाई when a patient came that sir, whenever I wake up, I started this sneezing. I started getting coryza. I have allergic rhinitis, and whenever I wake up, I am getting this. So the next question you have to ask: if you sleep in the afternoons, and you wake up, still you got this paroxysm? Patient said yes. If you wake up in the middle of the night and you still get that paroxysm, yes, then it is lachesis, aggravation after sleep, and it is mentioned in Nash's book. If you see on the right hand page, he written, and he also gives the potency, give it a 18-200 potency, and this will settle the whole business for the season. कि भाई एक बार दे दो वो पूरा सीजन अच्छे से निकल जाएगा 200 के डोज में. So that's how we have to सर्च इन द अदर बुक कि इसके रिफ्लेक्शंस क्या है. इसलिए डॉक्टर फाटक ने कहा कि sometimes the remedies have same motive but the different reflections. So we have to catch up the reflection. That is not there in the Allen, because it gives you plain symptoms. Then you have to work on it. You have to read it, and you have to see how this symptom is getting reflected, how this modality is going to reflect it, how gelsemiums, when patient has some, when the patient is reminded of his loss, कि भाई सर मेरा तो बहुत नुकसान हो गया. Whenever इनको ना ये बात याद आती है, then he get this trembling attack and this anxiety attack, and this is not arsenic, this is gelsemium. अगर आप जाएंगे एलन के नोट्स के इसमें कि एग्रेशन आफ्टर रिमाइंडिंग ऑफ हिज लॉस, कि भाई इसका इनको जब भी ये याद कोई दिलाता है ना तो सर उनका ये पूरा भर जाता है, ये ऐसा हो जाता है, देन ही गेट स्टार्टिंग पैनिक एंड ही हैड दिस अटैक, देन इट इज जेलसेमियम. सो दिस इज लैकिंग एंड दिस शुड बी लैकिंग. हमको बाकी बुक्स है वो पढ़ने के लिए. We cannot incorporate each and everything in Mathematical. That's why not a single Mathematical is complete. Those who are writing it, they also said कि भाई कोई Mathematical complete नहीं है, and हम जितने Mathematics लाएंगे उतने ज़्यादा reflections हम देख पाएंगे patients के. But the basic should be this, and that's why you have to read it again. कि भाई आज मैं जो पढ़ रहा हूँ वो कल शायद मेरे को कुछ अलग ही मिले. So this is, I cannot say this is the limit, and this is the limitation of a homeopath, how he sees and perceives the symptoms. But yeah, this is a symptom because it is very hard for the beginners to understand कि भाई इसको कैसे interpret करें या फिर इसको कैसे हम reflections में देखें patient को. Yeah, this is a limitation, but you have to work upon that each and every, because not any author will give you the whole reflections. कि भाई कोई बोल देगा कि भाई ऐसा ऐसा नहीं, 100% नहीं. There are many ways of to prescribe a remedy. That's what can say. This might be, you can say, limited. Otherwise, I couldn't see any limitations. Yeah.
तो एक और चीज आई वांटेड टू आस्क कि अगर हम एक केस ले रहे हैं और हमें बहुत क्लियर कीनोट सिम्टम्स नहीं मिल रहे हैं, दे आर एब्सेंट, देन हाउ कैन वी डिफरेंशिएट रेमेडीज बाय यूजिंग कीनोट्स?
What we see कि अगर हमें क्लियरली कीनोट्स नहीं मिले, कीनोट्स क्या है? कीनोट्स आर द peculiar symptoms of this remedy. That keynotes also include कि भाई ये पेशेंट का ये कॉन्स्टिट्यूशन है, ये इसमें मोडलिटी मिल रहा है, ये है, एंड इट्स ऑल्सो उसमें ऐसा लगेगा भाई these are also with the characteristics. Sometimes we didn't get characteristic, but we get the general symptoms. We can get the thirst of the patient, we can see the constitution of the patient. You have to prescribe upon that. Okay, simple. If you want to prescribe a petroleum, what you will see in petroleum patient, आपको क्या देखना है? आपको petroleum patient बताइए. Patient should have this crack and palm hands, जो भी होगा, जिसमें हम देते हैं विंटर में आ गया क्रैक से वगैरह, petroleum. But we have so many remedies for that. We have more chapped hands में जाएंगे तो causticum है, graphitis है, soranum है, sulfur है, sanicul aqua है. But if the patient, and this is the only symptoms we are getting, but if a patient have the mentality or the mental symptoms like naxomika, if you go through Allen's keynotes and if you see irritable, quarrelsome like naxomika patient, then you had your prescription. It is naxomika. If the patient is very fastidious, fat, obese, you can go for graphitis. If the patient desires sweet, congestion of the parts, hot and palm soles, then it is when with the cracks palm, it is petroleum. If a patient has this mixed symptoms of silica like perspiration on the head, dry skin, tuberculum like restlessness or changeability, then you can go for saniculaco. So that's how we have to differentiate. But if you see that the keynotes are only one peculiar characteristic which is mentioned in that book, no. Keynotes are arranged, what I'm saying कि भाई keynotes सब है. Keynotes में पेशेंट कैसे दिखेगा, पेशेंट कैसे आएगा, पेशेंट कैसे बोलेगा, पेशेंट में के मोरालिटीज क्या, डिजायर है, सब 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 लिखा है. आप ये मिसकंसेप्शन छोड़ दो कि आप जो भी एलन कीनोस ने, जिन्होंने भी एलन कीनोस पढ़ा है, वो देखेंगे कि उसमें एक ही सिम्टम नहीं है. मैं वही बोल रहा हूँ कि दीज आर नॉट द हैप्पीज़ सिम्टम्स व्हिच आर इनकॉर्पोरेटेड. उसमें सब एक सिस्टमैटिक वे से दिया है. पेशेंट का कॉन्स्टिट्यूशन तो आपको दिखेगा, पेशेंट के आपको ये मिलेगा, यू हैव टू प्रिस्क्राइब अपॉन दैट. एंड वी, हम बहुत बार उसको ओवरलुक करते हैं कि भाई एक कोई सिम्टम मिल जाएगा वो कीनोड है. नहीं, ऐसा नहीं है. समटाइम इट इज द कॉन्स्टिट्यूशन, sometimes it is the modalities, sometimes it is the peculiar symptom which it is we are prescribed upon, sometimes it is a grand generalization. So that's how we have to proceed कि भाई ऐसा नहीं है. That's why मैं सबको बोलूँ कि आप एक बार ये बुक से you just go through that book and you will see कि भाई सब systematic तो लिखा है, कुछ ना कुछ तो 100% पेशेंट में मिलता ही है. हाँ, to understand many symptoms you have to refer other books because there are, these symptoms are universal. The symptoms written in Alan Kunos, they are mostly universal. कि भाई आपको सब मोटाइम में कुछ ना कुछ मिलेगा उसका. And then the author has explained it with their own understanding. तो आपको ऐसा नहीं कि कुछ नहीं मिलेगा. There should be something we have to कि भाई आपको मिलेगा कि प्रिस्क्राइब करने के लिए. There are many things.
We have one more question in the comments. What about ringworm in homeopathy?
Ringworm in homeopathy has very good scope. Yes, it is tedious. Yes, it is difficult, sometimes difficult to do it. But if you go with the system, you will get it. No problem. Night में बहुत itching है, heart patient है, and all the vesicles are surrounding it. We can think of mesarium. If the patient has isolated spots, we can think of sepia. If the patient does it is merging and this merging of it, then this tellurium, then the isolated spots are there, then it is sepia in the lower limbs mostly. If you get it, we have so many symptoms. What we need sometimes is a specific which we don't have and which don't work every time. Like you go basalam de dena ठीक हो जाएगा, delirium हो जाएगा. This doesn't happen like this. So we have to go understanding भाई better by warm है, better by cold है, bathing से ambulation है नहीं है, how it is started, कि perspiration से heat option से होता है तो you can think of anti-crude. It had same aggravation like most of the patients said that गर्मी होती है तब ये बहुत बढ़ता है. You can think of anti-crude. Patient is saying that it is getting very black and it is get tarry and it is very dry. You can think of alumina. So you have to think like that. So this how we should treat. And ऐसे ऐसे हमारे रिपोर्ट हमारे मेट्रिक में दिया है कि ऐसे ऐसे इंडिकेशन है, तो यू हैव टू ऑन दैट. कि कोई बोलेगा भी रिंगवर्म है सर बता दो 4 मिनट. You have to see how it is started. Yesterday I had a case of ringworm patient who had severe ringworm in his neck and other parts, and all had started after her father died. To prescribe Ignitia 201 dose. On the second follow-up, the patient is very better. So it is how you approach the case. It's always how you approach the case. But what we people want ready-made therapeutics, which is not bad. But sometimes we have to take a case in a proper manner so that we can get a 100% we have to get education. Yes, sometimes there are some artificial chronic diseases which are intermingled because patient इतना सब खा के आता है, क्लोबेडासोल घस के आता है, तो most of the symptoms are getting obscured, वो नहीं मिलते. But still we have something to prescribe upon. We have to take it as a one-sided disease. एक symptom है उस पे prescribe करो, आगे और देखो क्या होता है, फिर next symptom आएगा उस पे prescribe करो. It is like that, and it is all mentioned in the organon which I'm saying, and if I'm not wrong. So if it happens, we have to go. And Hahnemann also, the artificial coronary diseases are very hard to treat, and that's why ringworm is hard to treat, because most of the time it came from with so much suppression, and after allopathic the original disease has gone deeper and deeper and deeper. But there also we have to take it as a one-sided disease. Take a first symptom, one symptom, prescribe upon that, see what comes next, see what comes next, see what comes next, until and unless you reach the core. After it is then it is very easy. If you get a virgin case, then it is no problem.
So it's the art part of the homeopathy.
Yeah, it's not art part. It's how you have your methodology and basics clear. Art part comes when you use a symptoms in a very different way. Okay.
Perceiving how you perceive the symptoms
Yeah,
and how you take them, take the note of them. It's basically
yeah. The art lies after you master it. Art,
we few
you
more other questions too. People are very interested in knowing a lot of things. Which remedy can we think of in eczema over first metatarsal right ankle?
right angle is always chilidonium, strontium carb. Yeah, but we have to go for the what are the characteristics of eczema. It is dry, it is scabby, it is moist, it is weepy, it is bleeding while scratching. After that, you can prescribe. Just मेरे भी के इधर है तो क्या देना, उधर है तो क्या देना. This will not work. Just that's what I'm saying. कि भाई इधर है तो ये देना. Otherwise, ignition is not being prescribed in the ringworm cases. Okay. हम कि भाई यहाँ पे है तो सर क्या दे यहाँ पे तो it is not the way. Sometimes it helps, sometimes it's not, but it is not that the way. I don't practice like that. Yes, I.
So,
Hello.
so you like you first said, it's about totality. You have to make a
All
totality.
always about totality. It's always and always about totality. We have to prescribe on that. Otherwise, we will get very limited. आपका डिसीज कहाँ पे लोकेशन sometimes matter, but sometimes the whole totality matters.
Everything, location, time, sensation, modality, you need everything.
You need everything. You need everything.
I think we covered all of our questions, and it was a very beautiful session. People were very interested and very engaged. So I was also very like, constantly engaged, and there was no loss of connection in the thoughts. So thank you, sir, for this wonderful session.
Thank you.
And I hope if somebody left their questions or they were not answered, you can let them. You can leave them in the comment box when we post that, and you can get your answers there. And we keep doing these type of sessions with a lot of doctors, and we do these to enhance the knowledge and just keep the flow of conversation going. So if you want to get to know the notification for that, just keep do follow us for that. And thank you so much, sir, for agreeing to do that. And have a nice day, everyone. And sir, you too.
Thank you so much. Thank you.